CBS Atlanta News presents Public Affairs on Peach.
Well, it is a law that has caused a lot of controversy. Several states challenged President Obama's health care reform law, and it will all lead the way up to the U.S. Supreme Court. It did go there. Good Sunday morning to everyone. I'm Brandon Rudad. The Supreme Court upheld that law, which means you'll probably be seeing some changes in your health care plan choices for this coming year. Mindy Smith is an attorney here in Atlanta, and she joins us here in our studio. Mindy, good to have you here. And I should preface this with, when it comes to health care, it's probably the most confusing topic anyone has ever had to talk about. It's just confusing because it's so big, it's so broad, and the scope of it is just so huge, and yet so specific at so many times. All right, so I think a lot of people want to know, now that the U.S. Supreme Court has basically upheld the law, right? There are a few things that are happening now, meaning that have gone into law now. We've got open enrollment, right? So your child can be under the parent's health care until what age?
Age 26, Brandon.
Okay, so they can be under their health care until they're age 26. What are some of the other laws that are in effect now that people should be aware of?
Well, businesses particularly need to be aware of the new health care law, and whether you agree with it or not, it passed. And just like Justice Roberts said in his opinion, the Supreme Court, the policy of the Supreme Court is to interpret the law, not to make policy judgments. And those judgments are entrusted to elected officials. And basically, Justice Roberts said in his opinion that if you don't agree with the law, then you need to vote these people out. So, like it or not, this is an election year. The law was upheld by the Supreme Court, so there will be changes. One which you already mentioned is that children up to the age of 26 will be able to remain on their parents' policy. Another change that will be implemented is during open enrollment this year for 2012, there will be medical, dental, vision reimbursement accounts, and each employee can contribute up to $4,000 into a health savings account. A lot of the controversy surrounds the issues of small businesses of over 50 employees. And if they do not cover their employees and offer insurance that is comparable to what the national plan would offer, then they would receive a penalty by the government of approximately $2,000 per employer. So this is, again, part of the controversy, because companies that are on the edge of that would say a workforce of 45 to 55 employees may choose to trim their workforce down slightly so that they do not come under the mandate, because businesses under 50 employees are not required to offer coverage to their employees as businesses of over 50 employees are. Okay,
so I think the argument here is that if you have a small business, right, and that since the federal government is now saying that we'll impose an employee or an employer a certain amount of $1,000 fine if you do not give that employee health insurance or give them an option to buy into some sort of health care, correct?
That is correct.
All right. So we're fearing, or some people are fearing, that these small businesses will then say, well, I've got 55 employees or I've got 60. If I get it down to 49, then I don't have to provide any health care for any of my employees.
Yes.
All right.
Yes.
So the Supreme Court has ruled, and the law is the law no matter which way you think about it, no matter if you're a small business, you disagree with it, you've got to go with the law now. But there are some things that I think both parties have agreed on that have gone into this law, and one of those pre-existing conditions, that a health care company, right, if I've got a certain health issue, I can still go and they can't upcharge me for going and get that health care service, correct?
They have to offer you coverage. They can't decline you coverage, but they can charge you a higher premium because the cost is going to be shared, amongst individuals. Right. That's what insurance is. It's a pool of individuals contributing, and the cost is shared. So yes, the premiums would be slightly higher for someone with a pre-existing condition, but they cannot be refused coverage. So basically, insurance companies have to consider that and offer them coverage. And the argument is that if someone has a pre-existing condition and their poverty level, could they even afford the premium? Right. Some estimates would be that a pre-existing condition, a very serious pre-existing condition, could cause the need for the implementation of a $400 per month premium. So if someone's on the poverty level, could they even afford that anyway? So there are lots of questions, and of course this is a hot button topic, Brandon. This is an election year.
Well, yeah, and we're getting, honestly, in all honesty, we're getting mixed messages from political opponents who are out there right now. Of course, you have Mitt Romney, who went on an interview one day and said there are certain things that he liked about the health care law that he wasn't going to repeal, and then the next day Paul Ryan was out there saying that they're going to repeal everything. I guess my question to you would be, some people are saying, okay, well, let's say Mitt Romney wins and he goes and he takes over as a president and he wants to change the health care law. Can he do it with one swipe of the pen, or does he have to go through the same chambers of Congress that Obama had to use in order to push health care law through?
The answer to your question is yes, he can change the law. He can try to repeal the entire law, or he can just repeal portions of it. My guess is that the Republican Party will try to repeal portions of that, which impose a penalty on individuals for not getting health care, a tax penalty that will go into effect. My guess is that the Republican Party will preserve some of the provisions of the health care reform law, and some of the provisions, you know, are very reasonable, and some are not, according to some political proponents. If he gets elected, what would happen is he presents to Congress, just like any other bill, his idea for repeal of those particular portions and replacing them, or his ideal for repealing the whole entire health care law. And then, of course, Brandon, after that, it's a game of numbers, and Congress would have to vote on that. It would have to go through the House of Representatives and the Senate, just like Obama's health care plan did. And it's a game of numbers as to who will be in Congress and who will be in Senate, how many Republicans versus how many Democrats. And I'll remind you that not a single Republican voted for Obama's health care law, not a single Republican. So this election is pivotal. This is an important year. I certainly do encourage people, whatever side of the policy debate you fall on, please go vote, because your vote is really going to matter this year.
Yeah, and also check with your medical providers as well. We were having health screenings here today and just having a conversation with a couple of them on how it even affects health screenings and what's going to be available to people, and also incentives for people to stay healthy within the workforce, which is something we're going to be talking about in just a few minutes with another guest. Mindy Smith, always good to have you on. Appreciate your time this morning. Employees continue to try and cut their health care costs, but coming up next, how some companies are now encouraging their employees to get healthy and the incentives they're now offering you to stay healthy when we come back.